From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. Happy leap year to all our THERAPALs. I guess now is a good time to let all of our listeners know that for the past 3 years, we've actually been recording an extra 15 minutes each year. So in 2021, we will actually be doing a bonus episode.
Perfect.
Yes. And now, broadcasting from the churn, that guy is Dr. Jim Jobin. I'm Nick Tangeman. It's time for some Pod Therapy.
People don't know this, but Pod Therapy takes astronomy extremely seriously. And,
Yes.
you know, we want to nail that calendar. You might think
Yes.
that this is just a sloppy crap organization and we just throw it all together at the last minute.
That's how we want it to look.
That's how it looks.
But,
yeah. You have no idea how hard it is.
When you see everything, you know, behind the scenes.
Oh,
and,
jeez. We have this whole, like, you know, it looks like NASA over here with all of our gizmos and gadgets. And you know, who can tell you
the
that?
amount of people that work for the show.
Oh, God.
I mean,
yeah, we want to thank them, you know. Just like NASA, we, the astronauts, are a very visible part of a very large team, you know. But there's so many who go into making the show possible.
Right.
Like Jacob. Jacob's part of that.
All right, and that's it.
Yeah,
End of list.
We want to thank everybody. We want to thank the whole team that really makes Pod Therapy possible. So we are joined in studio today by none other than ex-officio THERAPRODUCER board member and recent chairman of the board.
The boss.
The boss, Easy Whip.
Let's get weird.
Yes.
So Easy Whip joins us from the Northwest, man, Seattle, Washington. And when we were outside, I go, so how is it up there? He goes, shitty. And I go, dude, that sucks that you flew here on the one day it rained in Vegas.
Oh, that's true. Yeah, it was raining all day
pouring
yesterday.
and he was here for that.
Oh,
It's just a tough time, man. So you came into Nevada for the caucuses?
I came to get away from the weather.
Okay, and you found it. Yeah.
Yeah. And even though it was crappy yesterday here, it was still 10 degrees warmer than.
Oh, wow.
So
Still warmer than up north. Jeez, man. Have you ever been up to Seattle yet, Nick?
I have not.
Neither have I, man. I really want to go.
Yeah, I really want to go up to the Northwest.
Jacob, have you ever been up to the Northwest? Portland, Seattle area? What do you think of that?
It's great.
See? He loves it.
Yeah,
That's what I heard. It's fine.
No, Seattle's great.
That's what I hear. I hear it's beautiful. I see pictures of it when people travel up there, and it just doesn't seem real.
I don't know
There's
if
waterfalls and
yeah, I don't know if
The coldest I've ever been was in Portland, Washington.
Oh.
Well,
that's just confusing. They should not have a Portland, Washington.
I'm pretty sure it's Portland. There's a Portland, Washington, right?
not that I've heard of, but there's Port something. There's Port Angeles.
Maybe it's Port something. I don't know.
Okay.
Anyway, I was there for a tour stop.
Huh.
So I wasn't there on purpose. I was there like I was there for work.
To be clear.
Yeah. And we had is some Broadway tour. We were unloading the trucks first thing in the morning, 7:30 in the morning. And on the loading dock with the wind chill, it was like negative 48.
F. Oh.
Yep. And I was just angry. I was just pissed off.
Oh.
I said, I'm going to be inside. I'll sort what comes off the truck inside.
Jeez.
Just send it all inside, and I'll deal with it inside.
Oh my God! At that temperature, your fingers don't work. Like there is just nothing you're gonna do.
Well, because this was a 4 or 5 truck tour.
Oh, jeez.
And normally I would stand on the loading dock as things are coming off the truck and just bark at people as they're rolling things off the truck. Take that thing there. Take that thing. That thing goes to wardrobe. That thing goes stage right. That thing goes downstage center. That thing goes to electrics. Whatever.
Negative 40.
And I was like, no, I'm not going to stand out here and do that.
No, to screw that noise.
It's all coming inside, and I will sort it once it's in.
Oh my!
I've experienced negative 47
in Iowa. Is that where you're from? Iowa.
With that's wind chill factored in,
right?
But yeah, I mean, anytime it gets like,
and this was not terribly windy either. This was
didn't matter.
It was the wind
coming
chill.
Off the water.
It was the wind chill, but mainly it was just crazy cold.
Yeah.
Jesus.
Yep,
now, what
miserable.
was it like in Seattle? You
Terrible.
said 10 years younger than here, so it was like what, 50?
Yeah, 40, 50.
Okay, but it doesn't get like plummet cold in Seattle, right?
Not usually.
Okay, so you guys just get lots and lots of rain, lots of gray skies. Which is actually, I think a huge point. We've heard a lot of people talk about the depression rates. We've seen data from that region.
I think that would be the number one reason why I don't think I could live there.
Yeah.
Otherwise, from what I've heard, it's beautiful. But
seasonal
seasonal depression would kill. That would. destroy me.
That gets a lot of press out of Seattle.
Yeah.
In my experience being there, I don't know. Easy Whip knows better than I do.
Well,
but in my experience being there, it's not a big thing there.
Okay.
It's exaggerated.
Oh,
there
okay.
you go.
I would say that's fair.
They add a lot to it to make it seem
Well, I
like
mean,
it's big.
Yeah, it's not nothing.
Yeah.
Yeah, I mean, even in Iowa, we didn't get the rain, but like during the winter, it would go from like November until late March, where there's just no sunshine. It's just
Well, in
constant.
Iowa, there's no seasonal depression in Iowa because people can't get past just the being in Iowa depression.
Yeah.
It's hard to diagnose.
Yeah.
People aren't even through
There's
that.
no
yet.
room for
People
this.
haven't started paying
Differential
attention to
diagnosis.
seasons.
You're
yet.
immune.
Yeah. It's like, oh, there's seasons I haven't noticed because I live in fucking Iowa.
Yeah. Every day is a gift in Iowa. Who by the way, has still not called a winner in their caucus. So if you want to know how the Nevada caucuses ended up going, you can go to patreon.com/therapy and sign up for $1, and you can hear us discuss at length.
Or Google it. You'll get a better answer.
Yeah, probably true.
But you won't get our answer.
That's right. And you won't know what Jacob's experience was like. You won't hear Nick's fantastic apology. You won't hear a lot of things, which you can only buy with $1.
I don't believe I ever said I was sorry.
Let's let the listeners discover that first.
I heard an in-depth apology.
Thank you. That's what Jacob heard. Jacob knows how to make money for the podcast. Okay, you're just giving away stuff. It's called a hook, Tangeman. So Easy Whip, you financially support this podcast. You are now the boss. Tell us, when did you discover Pod Therapy, and tell us about your relationship with the show.
I discovered it Scoop Fest, the last one.
2018.
18, yeah.
Yeah.
I just sat in on the live recording of it, and I liked your guys' dynamic. I liked how you ran the show, and
Cool, man.
it just got me thinking about mental health, and I had already been thinking about it, but it I guess was a catalyst for more serious thinking about it, I would say.
Yeah.
Wow.
Yeah.
That's really cool. So you were telling us in some of your writings preparing for the show that your own journey of just how to get into therapy and check in and stuff had just been really complicated. But it sounds like what you're also telling us now is, that journey kind of began with just seeing real therapists on a podcast and was like, oh, maybe I'll do this. That's awesome. That is like the highest possible compliment that we can ever get.
It's kind of why we started this.
That is exactly it. Yeah, so that's awesome, man. So that launched you into a process whenever you got home of saying, all right, I'm going to support that show. That's good. Mental health is probably a good thing. And you know what? It's time for me to find a therapist. So take us into that story a little bit, man. Whenever you were ready to find a therapist, how did you go about finding a therapist?
Well, I had been thinking that I needed to see a therapist for quite a while, and I wasn't really actively looking because I was expecting the worst based on past experiences. And it's not something you can bring up at a party. Like, who's your therapist?
Right.
Who's your therapist? Can you give me a recommendation?
No, you need to go to Jacob's parties.
We've-
That's where that comes out.
I mean, we've kind of talked about that on the show too. It's like that's one of the biggest issues with fighting the stigma. I think we're getting closer. Like I actually hear people mention that. Where was I? I can't remember. I think it was actually at the dentist, and my dentist was talking about seeing their therapist or something like that.
Oh wow! It's
and it
starting
wasn't,
to just
and they
come
didn't.
out.
Yeah, and it wasn't
They
because
said hygienist.
Yeah,
you know what? I was.
You were half under.
I was.
Yeah.
Yeah, I was heavily sedated at the time. I'm not
They were
exactly
telling you to
sure.
floss.
How often do you floss? You have a therapist too?
No.
No. What?
Dial back the gas. Dial
Yeah.
back. He's not okay.
No, and it wasn't because they knew I was involved in it.
No.
It was just something that they just kind of brought up, and it caught my attention because I was like, oh wow,
It is starting to
That's-
get a little bit better. Yeah,
Yeah.
but I think you're right, Easy. It's not like that where you people don't casually bring it up.
You can't go to a party and ask like who's your mechanic, right?
Yeah,
like,
yeah.
Or who's your therapist, like you could with who's your
Right.
mechanic? Who
You
does
could
your
ask
hair?
those other
Who,
questions.
yeah.
Yeah. You seem very emotionally balanced. Who's your therapist? They're doing a great job. But you're right. So it's hard to find one whenever you're first starting that process of like, well, where do you go next?
And you had actually written into the show about this too,
Yeah.
didn't you?
Yeah.
About finding a therapist.
A couple of times. I think I might have done so once anonymously also.
Oh, okay.
Because I was really frustrated. But so I've been struggling with like depression and suicidal thoughts and some addiction issues and some family issues also. And I delayed even looking for a therapist until after I discovered your show, and even like a year past that, almost a year. But right around the time I discovered your show, I had a friend who had found a psychiatrist that, and this friend has similar problems as I do, and he said he finally found somebody that was able to like laser beam accuracy help him with his issue, so I, it was always on my to-do list to call that psychiatrist and get an appointment. It was going to be like a 2-hour drive to see him. And that was one of the reasons why I delayed calling him. And by the time I got around to calling, he wasn't taking patients. And I think that's one of the things that caused me to write in, being frustrated that there was no wait list. And
that is incredibly frustrating.
Yeah, your very first try, and you finally work up the courage to do it, and you go, okay, I'm getting a good recommendation from somebody going through things. He knows me, he knows the provider, and then you finally make that effort. It's far away, and they're not seeing anybody anymore.
Right.
Jeez, that's rough.
Now, when you actually made that phone call and then they said, we're not taking any new patients, did they give you any kind of direction on, like, here's, try this, or try this company, or try contacting your insurance, or did they give you any kind of direction?
No, they basically said, sorry, we can't help you.
Jeez, that is rough. So obviously you had to pivot from there. Where did you go next? What'd you do?
I tried to kind of trust the process, and I just kind of chose an agency that had a decent looking website, and they had good write-ups, bios for the different people that worked there, and I tried filling out their web form to have them to kind of narrow down who I could see, and they never responded to the web form. And
jeez.
And so I was like, well, I hope nobody's in serious trouble
Right.
trying to fill out these web forms and wait and never getting a response.
Jeez.
And so just out of spite, I didn't follow up with them for a few weeks, and then things were getting bad with me. And so I finally called and told them that I had filled out the web form and they couldn't find my information. And so I went through it again and over the phone, and basically all I told them was I wanted a female therapist with at least a master's degree. I didn't want somebody fresh. One of the junior therapists, I think you called them in the previous show. And they said they didn't have anybody available that met that criteria.
Really?
Yeah.
Wow. I feel like you just
That
described
seems like-
80%
yeah.
of our field.
That is 80% of our field. If you were to look for a male therapist, you'd have a tough time.
Yeah, that's interesting. And I didn't. We'll have to look up Washington's requirements,
yeah.
but I would imagine almost all of them would have masters, and usually it's very rare that a state will allow anybody at a bachelor level to do therapeutic work. Sometimes substance abuse, but really, really rare. So strike two.
And again on the phone, it was basically, sorry, we can't help you.
Yeah, so just not very encouraging.
Have
not
good luck.
saying,
Yeah.
oh, jeez.
And this is actually one of the issues I wanted to talk about with a therapist is, do I have some kind of blind spot with how I'm communicating on the phone that causes people to dismiss me like this, or what's going on? But I'm getting a little ahead of the story there. about a week or so after that phone call, I decided I was just going to go down there because it's not as easy for them to dismiss somebody that's standing.
Yeah,
sure.
Right. And this is like Dr. Jim said, gathering the courage to even make the first call was huge.
Mm-hmm.
It was a huge feeling of vulnerability and trying to overcome that. And here I am driving to a place and trying to demand to just let me see somebody, The third time was the charm. I got assigned somebody, and she ended up being a junior therapist. I mean, she had a degree, but she was still
in her learning time.
She still had one initial on her title that
intern.
She was working to drop
some kind of version of intern,
something like that.
Yeah.
But I was working with her for a few weeks. Turned into a couple of months, and she had potential.
Yeah.
And so I kind of stuck with it. And then after a few months, she kind of went cold and robotic on me. And even at one point said I was being stubborn. And I didn't think anything of it at the time, but because I've been called that before, mostly by my wife. But after a couple of days, I started thinking that's not something a therapist should call their patient. Name calling doesn't seem like the best approach.
I've tried it, and it doesn't work well.
And it just
always worked well for me.
Yeah. I lean heavily on slurs. I like slurs. That gets the point.
Well, it's the only way Jim responds. So the Jim's not a fair comparison.
You have to drill.
Yeah.
But so that word stubborn. And, in fairness, I guess I could see that being like an interesting thing where I would wonder what the context was. But what matters at the end of the day is, in this case, the patient heard that and heard a hurtful term, and felt like, hey, that's not our relationship. We're better than that.
It felt callously dismissive.
Okay.
Like my hesitations, my fears weren't being treated seriously, weren't being respected. It was just being written off as being a stubborn dude.
Yes. Okay, so this is a really good point for any potential students or anybody who's learning to become a therapist and may be listening to the show. I don't know why. But there are some things that I'm hearing you say that actually is really important, because you're talking about being dismissive. The way that you described the therapist was kind of robotic. And essentially what I'm hearing you say is that it's kind of like the human element of it is being slowly drugged back and removed.
Yeah.
And I think that's a very important lesson for anybody who's learning to become a therapist, is that that's always going to be your fallback position, is just being a human being and having human contact and just being respectful. If you've tried a whole bunch of different therapeutic techniques and you can't seem to get anything to work, you fall back to being a cheerleader and to just being a human being and having some kind of a connection.
Yeah, and Easy Whip, we just met you today, and I've met, there's different kinds of people and their different personality expressiveness and stuff. I could see where a therapist might not have detected that was hurtful. And this goes back to the advice to new therapists or up-and-comers. You always, if you don't have somebody that's telegraphing to you what they're feeling from that, ask.
Yes.
Always okay to ask and be like, sometimes, Easy, you just kind of seem stubborn to me. And then if you're kind of met with silence on that, give them another. Let me ask you, when you hear that word stubborn, though, I want to make sure we're on the same page. Do you hear it the way I mean it? Because teach me how that means it to you.
I've done things like that early on, too. Like, I've kind of asked questions like that.
Right,
but then I've also since then learned to not say this looks like stubbornness to me, but instead focus on specific behaviors that are observable. Yeah. So I'm seeing you kind of sit back in your chair. I'm seeing your posture change when we talk about this. What does this mean? And therefore, I'm not throwing a label.
Or pick a word that's more helpful, like, hey, you seem resistant to what I've been asking you to do. Help me understand why. Teach me why this thing that we've been working on hasn't really fit naturally, and why I don't think I see you doing it.
And I've even learned, I can't talk, learned to use reserved instead of resistant.
Sure. Yeah.
Resistant is another word that I've kind of started to eliminate out of my vocabulary, especially working in addiction.
Yeah.
Because one of the things that we talk about the stages of change. Right. And how there's pre-contemplation, contemplation, action, so on and so forth.
You missed preparation.
Preparation. Yeah.
That's the one.
Yes, I
You
did
got
miss
it.
that.
If you were better prepared, you would have gotten it.
Yeah.
Exactly.
Thank
Now
you,
I'm
Jacob.
in the pre-contemplation stage of change for being prepared for the show.
Wow, that was good. That was good. Somewhere some kid is reading
idea-
ASAM and is like, oh.
There it is. That was a good one. Somebody just got a boner.
That's
Some grad student.
But the idea is that we throw resistant in there to describe people in the pre-contemplation stage of change.
Right.
When in reality, what we should be doing is understanding that everybody on Earth is in the action stage of change for something.
Sure.
We just have to figure out what that something
that
is.
Good
and then we
point.
find that and latch onto that.
So, Easy, you were saying that you finally get into a therapist. You're seeing them for a couple of months and giving it a shot. There's potential. But then the two things that really start to weigh on you, it seems disconnected. There's starting to feel like a roboticism to it. We're not feeling human anymore. And then at some point, the therapist kind of throws around that word stubborn, and it just feels sort of reckless. It feels a little hurtful. Take us further. What happened next?
Well, all of this didn't occur to me with the first therapist until retrospect, mostly. But and then with the second therapist, I saw the pattern repeat, and that's kind of what started getting me thinking. But for now, I'll stick with the first therapist. I think in my case, what was going on, I was seeing her for suicidal depression, anxiety, and during our sessions, it was brought up that I was abusing alcohol. I was excessively drinking for quite a while. And I think what had happened is she decided that was the treatment that needed to happen first was the alcohol abuse. And we talked about that a little bit, and I agreed that it doesn't make sense to try to treat depression when you're taking a depressant every day.
Okay.
Right.
Yeah.
That's good insight.
That is good insight.
And I'm willing to consider options. I'm willing to talk about it. We can talk about it every session. But I have some reservations about some of the options out there.
Sure.
But I'll come in and talk about it every week if you want. But at that point, she had decided that was the way the conversation was going to go. And she kept trying to steer it in that direction. And then she finally said that she was being promoted or working her way up, and that her availability wasn't. She wasn't going to be available to see me anymore.
Right.
And the second therapist also cut me loose. I didn't cut her loose, but at least this first one had the decency to lie to me about why. And I didn't realize that was what had happened until the same thing happened with the second therapist. And then I went back and looked up the first therapist, and her profile's still there. She's still taking appointments on the days that I was seeing her.
Oh, okay. So it sounds like, to untangle that for the general listeners, because I think we were able to read what you were saying. At first, the first therapist, down the road quite a bit, eventually tells you, hey, listen, my status is going to change. My career is bending in a different direction. That means I'll have decreased availability, and so I'm going to transfer you to another therapist. That way we don't, just drop you in the mud. And at the time, it sounded like, okay, yep. And Nick and I, as we heard that, we're thinking, yeah, no, that does happen a lot, especially if that person's an intern. That definitely can make sense to us. And then whenever you transfer to the second person eventually let you know that they were no longer going to be willing to treat you.
Right. And let's back up a little bit. The first therapist didn't refer me to anybody new.
Oh, okay.
I said I would be happy to see another therapist if you refer me directly to some specific person.
Sure, yeah.
I don't want to do the random thing anymore, the trial and error.
Right.
It's just a pain. It's draining. One of my issues I'm seeing a therapist for is this constantly being drained.
Sure.
All this energy with social interaction. And then every time I see a new therapist, I have to fill out the same paperwork and go through the same, 3-4 week long getting to know you stuff. And so my idea was, well, this therapist knows a lot more therapists than I'll ever know.
Right.
They obviously have people that they look up to or inspired them. Why not ask them who they would recommend specifically?
Sure.
And for the most part, I've had no luck getting any therapists or doctors to give a specific name for anybody. Even veterinarians won't give a specific name. And so that might be a tip for the professionals out there. If somebody wants a recommendation, give them a specific name.
Yeah. That's interesting. I wonder if that's a Washington thing.
Is that?
I don't know. Yeah.
Can a therapist just drop someone?
Ethically, no. I mean,
because like if I go to my doctor, if I'm being treated for something by a general practitioner, I don't think they can just like in the middle of treating me say, I'm not going to treat you anymore.
Yeah. No, there's...
or maybe they can. Maybe I'm ignorant to this. I don't know.
There are times that this has happened. I think the most common time that this happens for our field is our profession is very unique in the sense that we tend to promote people out of the thing that they're best at doing better than any other profession. So like we get that all the time with clinicians, like, man, you are such a good clinician. You're such a good therapist. We need to move you up to clinical director.
Where you're not going to
where you're not going to do any therapy, right? So we've just promoted you out of that position. And there's a lot of times that happens. And then there's kind of this mass exodus where we have to move people around and shuffle. And the other part, too, is then we've got internships. So you may be at an internship site for 2 to 3 years. And then once your internship is over, then that agency they're not going to typically pay you. Some will pay you more and because they'll want to keep you. But other times they just look at it as like, okay, you're done. We'll get another intern in here where we can pay them a lot less.
Right.
And so then that person leaves, and then you can't really just take all your clients with you because there's funding issues, and it just happens so often, and it's incredibly frustrating. But the best way to do it is to do a warm handoff. If you absolutely cannot continue to see somebody, if I know a therapist that I can refer my client to, I'll have the client sign a release of information. I'll talk to that therapist directly. Say, I need to, hand this person over to you, and then maybe we can, ideally, if it's possible, even just doing a joint session where you have 2 therapists come in there and sit in, and then so you can kind of.
But the heart of that question, Jacob, no. As a healthcare provider, it is not appropriate to just discontinue care for somebody.
Right.
However, there's a spectrum of things you can do to meet the requirement of having handed them off. The very bare minimum you could do is, well, let's say this therapist he was seeing was an independent practitioner like me.
Okay.
I don't have another therapist. There's not another person that works with me or for me that I would hand you off to. So if I'm going to discontinue care with somebody, which is pretty rare, I would send them an email or tell them in person, hey, for whatever reason, here's why I don't think that we work good together. I want to make sure you're succeeding. I think that you'd pair well with one of these people. And then I'll give them 3 or 4 of my therapist colleagues and be like, I want you to tell them Jim Jobin sent you. And that's usually all they need to get into the door. I've had therapists that are full caseload, and I've had a patient that I can't work with because I don't think it's a good fit for me or whatever. I don't think I'm useful to that patient. And I've, said, call this therapist, tell them I sent you, and then the therapist will text me and be like, hey, is, initials JH, really your guy? And then I'll text them back and be like, yeah, as a personal favor, will you take that patient? And they'll go, yeah, for you, Jim. And so then that's one form of handoff. What he's talking about, Nick's talking about, is a warm handoff. That's whenever you're in the same agency, or you make the call for the patient on their behalf, and then say, hey, Nick, I got a guy. I think he'd be a good fit for you. Would you mind taking him? I want him to do some alcohol counseling before I dive deeper into the depression. Can I route him over to you for 12 weeks and do that? And Nick will review it. But in this case, what Easy's talking about, it sounds an awful lot like that was an agency. That intern can't practice independently, probably, or wouldn't be very successful if they did. He found a website that had all their names on it. And so it's very peculiar to me that the therapist wouldn't say, so Easy, you and I aren't going to continue together. Here's my reasons why, which is fine. And it's possible, by the way, that she isn't lying. It's possible she's telling the truth, but that her caseload diminished greatly and she had to order them by severity. And then she should, in theory, have said, we're going to hook you up with a new therapist. Mm-hmm. The second therapist that you had, was that in the same agency?
No, that was kind of a strike of luck.
Wow.
A friend had just out of the blue said he was seeing this therapist, and she was wonderful. And I said, well, that's
what I'm looking for.
That's serendipitous.
Yeah. Wouldn't you know it? So they didn't warm. Okay, so Jacob, your astonishment is correct. That is inappropriate. If I heard about that and I was the next therapist, if I was therapist number 2 in Easy's life, I probably would have given those guys a nudge. I probably would have called that agency and said, hey, listen, I got a new patient. I won't name names. They say you guys dropped him cold. Let's check in about that, right? And, it's possible sometimes that the agency will say, here's why. The patient was extremely inappropriate. They made sexual, innuendos at the therapist. Fine. We don't owe them anything at that point. And, we fired them. We just fired okay, cool. And there's times whenever that might happen. Unless Easy's leaving out big parts of the story, I don't think that was part of it.
No, and I wanted to make sure to point out that there's nothing more to the story.
Right.
There was nothing like that going on.
Mm. So the second therapist, what happened there?
The second therapist was also young, also a junior therapist. Mm-hmm. But since I had the recommendation of a close friend, I was going to give her a shot. But I modified my approach right off the bat. Mm. I went in and said, you are not going to be my therapist. You're going to help me find a therapist.
Oh, okay.
And I want your help finding a doctor. And
okay, you're going to be my case manager.
I want help finding a whole team. This is the person I wanted to be on the phone with me when I called other professionals and try to unpack what was going on, why I get such hostility and resistance in communication. But the appointment time that was available with this therapist was at Friday at like 7 p.m. And so I was never going to be able to call anybody
with them.
Right. And it became pretty clear pretty quickly that she wasn't interested in helping me do that anyway. Her reaction was more or less, what's the big deal? Just call the closest place, take the first person available, and get it done.
For like psychiatry and stuff?
Yeah, and medical doctor. I was looking for a primary care physician.
Okay. And you wanted some guidance on that?
Yeah. I wanted to narrow down. I wanted to stop wasting my time, trial and error.
Yeah. You wanted somebody who actually hears the full story to then help guide you into what you needed to do.
And that wasn't working with her, and it was fine. The appointment time wasn't ideal anyway. And so I finally told her, look, it's fine. As long as I come in here and you tell me that you support me and that you encourage me, that's worth the copay every week. Right. That's more than I get out in the world. So if all you're going to do is let me talk for the whole session and tell me that you support and encourage me, that's gold. I'll keep coming back. And I told her the trick with figuring out how I'm doing is if I keep coming in to these appointments every week, something's working.
Okay.
If I'm talking about making plans 6 months down the road, things are working.
Right. Yeah.
Just to touch on that real quick, I like the technique that you're using there with like saying, hey, here's a good way to read me. Because essentially that's what you're doing is you're teaching her your cues, right? And that is so helpful for any therapist to know that stuff right off the bat. You know, and I'll even ask sometimes when I was seeing clients, I would say, you know, if something's going wrong and you're just not feeling it, how do I know? Like, what are the small little subtle things that you do that I could pick up on? Because, you know, getting that stuff right out in the open can save a lot of time.
Yeah, no, it's really good technique. So that one ended up coming to a conclusion as well.
Yeah, similar conclusion.
Okay, where they said, my career's changing, we're going to have to discontinue.
No, she took a different approach. She didn't lie to me or try to deceive me. She said, within 3 sessions, you're going to have to decide to submit to this alcohol program.
Okay.
And I took that as a dare. And I also told her that the fastest way to make me act contrarily is to tell me I have to do something.
Right. Yeah. A lot of complexity there.
And I tried to appeal to her. I said I wasn't opposed to counseling or treatment for the alcohol stuff. I didn't want it to be the primary thing, and I have the luxury of being choosy. You know, I'm not the kind of person that has to chug some whiskey in the morning or else I shake too bad. I'm not that far gone. I've never had a DUI. There's no violence issues or anything. It's a nagging problem and it's exasperating another problem. And so I feel like I kind of have the luxury of being choosy with what kind of treatment I seek out.
Right.
And she wasn't having it.
Okay.
So it sounds like she saw it as more of an emergency than you saw it as.
Yes.
Yeah.
So let me ask you this, Easy. In 2 situations, and again, therapists are imperfect animals, okay? But in 2 situations, 2 of these folks that did get to know you and were professionals, okay, they're qualified to do what they were doing or they wouldn't be allowed to do it. They gave you hot feedback and they said, you know, are you open to doing some work on the alcohol thing? And both of them said, we really feel like this might be square one, that the alcohol probably gets in the way of the other work, and we kind of need to clear the road so we can get down road to some of these other things. At this stage in your therapeutic work and career with this, how open are you to that? Is that something you're starting to look at and say, well, you know, 2 for 2. They made it a priority.
Well, the second one, even with the first one, I was willing to consider anything, and with the second one, I made a firm commitment. I said, even if I'm not getting a specific like addiction or alcohol counseling, I will stop drinking for a specific amount of time.
Okay, sure.
And I think when I was talking to her, I said I'll stop for 6 months. That'll, you know, that's not it's not what you want. It's not what I want. It's a compromise. It'll give you 6 months. It'll give us 6 months to continue working with that just out of the equation for now.
I see.
Right. And that's smart because that's you're basically removing a variable. Like we don't know exactly the role alcohol is playing in this until we remove it, and then we know.
So let me guess. The therapist said, well, no, I need you to say yes or no.
The therapist took the position that if I wasn't willing to say that I would never drink again for the rest of my life, that I wasn't worth her time.
Really?
Well, and
I don't know if I'm going to wear shoes again for the rest of my life. I don't know.
It's a rookie.
I can't tell you anything about the rest of my life.
Because, I mean, working in drug and alcohol treatment, my whole career, I've had people that have severely destroyed their lives on drug and alcohol. Sure. And I've never asked them to commit for the rest of their life.
Also, that's just committing to something for your life is... It's too much.
I mean, that's ideal, you know, for the folks that I've worked with, but it's not something that we...
But it's also a commitment that you work up to.
Exactly.
So, like, in substance abuse, you work up to a lifetime commitment.
Yeah, I mean, I always just start.
There's a reason it's one day at a time.
Yeah, we're just going to start very basic, and we're just going to go. Yeah, maybe
we're going to start. I'm not going to drink today.
Maybe an hour at a time, and then we just kind of look at like, okay, so we haven't drank in 2 days. How are we feeling? What are some positive things that we're noticing? And we just kind of start building off of that.
So easy. Before we kind of turn it over and start giving you as much feedback as I think we can from what
before we start just yelling at people.
Before we start yelling, I want to make sure that I've kind of got most of the data. It sounds like that was the last therapeutic experience you had, and now you're sort of back on the market trying to find the next partner you're going to work with.
Well, when that therapist dropped me, I went off the rails.
Yeah.
It was right before Christmas, the stress of the holidays, and the anniversary of my mother's suicide was coming up. It was just too much, and I went off the rails. I ended up going to the emergency room because I was feeling suicidal, and that was the first time I had gone to the emergency room. And I don't want to discourage listeners from seeking emergency treatment. It wasn't my favorite experience. I guess my suggestion would be try and take care of things before it gets to that point.
Sure. Yeah, no, it's not a resort. It's not the Hilton, but it's a good idea versus giving up. And so I'm glad you made that call. But sure, yeah, hospitals are not pleasant places.
Right, and so after that, kind of stabilized. I still haven't, even though I'm not seeing a therapist or anything, I still haven't been drinking.
Oh.
I stopped. I kept with the commitment, the time commitment that I was originally going to do. And then, so now I'm just kind of flapping in the wind, and I feel like I'm done with therapists, and that's kind of why I'm here, because I heard your show has the future #1 life coach on Ranker.
Yeah.
Of all the life coaches on Ranker, he is.
Am I on Ranker?
No.
Not yet.
Hold on. I got my laptop right here.
I guess it's just a rumor.
Yeah, that's what they say. But that straightforward kind of approach. Yeah.
Right.
Well, that's what Jacob's here for, man.
I'm still not over somebody telling you to quit doing anything for life.
Yeah.
I'm not over that person yet.
Yeah, I tried to tell her, and I tried to be patient with her because she is kind of new.
Sure.
And didn't have, addiction wasn't her specialty. And so I get it. So I tried to kind of clue her in on why I wasn't ready to say never again.
Yeah.
And why I think that's okay, and why I'm resistant about this treatment option, and why I would prefer this other treatment option. And
it's very simply like my work is less important than my health. And you wouldn't ask me to commit to doing the same job for the rest of my life.
Sure. Yeah.
Like that's lower stakes than what we're talking about. And somebody and if you said like, okay, you're going to be this job for the rest of your life, people would just look at you and say that's ridiculous. That's a ludicrous thing to say to someone to seriously suggest that they commit right now to spending the next 30, 40, 50 years of their lifetime doing this job.
And that's why I think anybody would kind of shirk at that. So it sounds like you've, since the December episodes and since doing a visit with the hospital, you've gone ahead and removed alcohol from your life for now, to give you that clear headspace to figure out the next thing that you need to do. And you're back in the looking around at therapists, but you're also admitting to us today, pretty discouraged, guys, a little gun shy here. And, I think that I'm trying to do the next right thing, but partly I'm kind of here to see if you guys can restore my faith in your profession and we can get this show back on the road.
I mean, imagine that with any other profession. Like if the first 2 dentists that you've ever had in your life.
Did I tell you about the one that gave me 8 cavities? That said I had 8 cavities?
I've heard that story.
Turned out you were just eating an Oreo?
Yeah. You guys should brush those before you check.
Yeah. But I mean, if your first 2 experiences were very bad, that can easily set you down a road of forget this. I'm done. I'm not going to mess with this anymore. Sounds like you're not quite there yet.
I'm pretty far there.
Okay.
He sounds there.
Appreciate the honesty. Well, all right. So we have a lot of work to do here. And I appreciate you bringing us kind of up to the present tense. I think that was pretty much the present tense of where you're at.
Right.
And that's kind of the big updates. So I definitely want to react to a lot of this. And here's what I want to be helpful for you, Easy, is as we were kind of coming in today, some of the themes that I kind of picked up from just the way you interacted with us and the way you interacted with Jacob, I can tell that you're really hoping for straight shooters today. I think that's kind of how I read you. Is that accurate?
Sure.
Okay, we're looking for just real truth. Why? Because you've said, hey, listen, and you said this earlier. If there's something about me that's, I'm wrong about something, let me know, because I don't want to, whatever, scare people or whatever's causing this to happen. And I don't think that's the case, but I just want that permission to sort of like try to give you as much accuracy as I think I'm seeing in my limited human perspective.
Sure.
Okay, cool beans. So let me kind of react to a couple of pieces of this. The first thing I think that's gotten the most attention from the room so far is a counselor saying, I need you to sort of binarily decide, are we going to step yes toward alcohol or no toward abstinence? And so here's kind of how I interpret that, okay? So when I first heard you say that, it didn't surprise me. And the reason it didn't surprise me is because it was a rookie therapist. As a drug and alcohol counselor, Nick and I have had to do a lot of work with people. A little bit ago, listeners heard Nick talk about the stages of change, right? We've talked about that on the show before. It has to do with somebody's awareness of a problem and whether or not they're motivated to deal with it right now. And so whenever you first hear the first therapist say, hey, I think maybe alcohol is part of the problem, it's natural to go, nah, maybe not, whatever. We call that pre-contemplation. You're not aware of it. Contemplation is the next step, and that's when you go, yeah, maybe this isn't making things better.
I'll consider it.
Perhaps. I'm open to it. Thanks for the feedback. Preparation is, hey, I recognize it's a problem, and let's talk about how we're going to address this. Teach me how I can make this better. I'm not doing anything about it yet. I might even still be drinking, but I don't know how to do something, but I'm willing to learn what to do about it, but we both agree it's a problem. Action is that big, vast part where we're doing something about it. Okay? And so why do I bring that up? Because I think that what the intern doesn't understand and what veteran therapists who work especially in addictions understand is that when Nick and I would meet somebody who needs to come to our rehab, step one is just getting them to say, do you think this is a problem enough in your life that you'd be willing to stop for 30 days? And that's all we're looking for because at the time we were running a rehab. Mm-hmm. And if they'll say, all right, why would I quit for 30 days? We'll say, well, A, probably just to convince yourself that it's not as big of a problem as you think it is. And B, let's clear your head. I mean, can we both just acknowledge the science that alcohol is a depressant, as you were joking about earlier? And can we get that out of you for a while so we can give your body a chance to figure out what medicines you could best benefit from or what work we need to do? And you're nodding because most people hear that and go, that's very reasonable. Right. Whether they're going to go to a rehab or whether they're going to do this in outpatient, most folks will hear that and go, okay, yeah, sure, man. I'm here visiting with a therapist to do good work for my mental health. You're telling me, hey, it would really help me to get this boulder out of the path for 30 days so I can get to work. Yep, let's do it. Yeah, and that's what a veteran's going to do that an intern doesn't. Now, what's probably happening, I'm guessing, that intern probably went to supervision with their leader, and the leader probably told them, well, obviously, if the patient doesn't realize alcohol is a problem, then we're never going to get to the bottom of this. And they didn't coach that intern in how to just settle for 30 days. And you were offering a hell of a lot more. You were like, hey, I'll stop for 6 months. A veteran therapist hears that and goes, I'll take it.
I've never heard somebody offer 6 months.
I'll take that so fast. Yeah. Hey, Jim, I'll give you 6 months. Sold. Sold. Yeah. That's absolutely
I'll come
good.
see you every week for 6 months.
Yeah.
Done.
Yeah. And I will be sober.
Yeah.
That's fantastic. So first off, that's how I read that situation. And I reveal that to you in some of the inside baseball because I want you to kind of hear that I don't look at that therapist and think, what an idiot. No, I think, what a rookie. They don't know the difference. They're seeing it correctly. And Nick and I would probably agree with that therapist that, yes, Easy's going to have to go ahead and include this as a primary thing that we need out of the way so we can reach deeper. Fair enough, right? He's anesthetizing his pain with this beverage. That's not making it better. He's self-medicating. So we need to remove that poor medication so we can have better ideas, right? So we would all tell that therapist, that's absolutely accurate. And we would say, poor execution, though. Here's how you can learn to do that better. Because what happened? You lost your patient. And anytime you're doing drug and alcohol counseling as a mix of anything else that you're doing, which, by the way, Easy, it's very, very common that people have both depression, anxiety, and they're self-medicating with something, right? These things are just going to live together. So it's very natural to see that, and this is where the therapist thinks stepped on their own toes. The execution was poor, and you lost your patient. And whenever that happens, that means, hey, you didn't handle that the best way you could have. Now, in this case, you didn't even walk away. The therapist decided that it was no longer going to be viable. What probably happened, I don't have their case notes, I'm guessing, is they probably were talking to their supervisor, because they're an intern, and saying, yeah, I can't get easy to agree to quit alcohol for the rest of their life. And that supervisor probably also didn't have an addictions background, especially if that intern didn't, and probably said, well, then, you know what? You have to tell them that you can't work with them. If they're not willing, if we all think about that in theory, that's fine in healthcare. If I tell you, hey, listen, I'm your oncology doc to deal with these tumors we found in your lungs. I need you to stop smoking. And you say, piss off. I'm going to do what I want. I'm going to say, hey, listen, I don't work for the government. I get to do what I'm going to do. And there's a lot of patients who want my help. Right. A lot of patients who need what I have and are willing to do what I tell them to do to get it done. If you're not going to deal with a primary barrier that's going to stop me from doing my work, I think that I'm not going to be available to help you because clearly you're not ready for help yet. Right? And so that's not crazy for a healthcare provider to do that. In this intern's case, that probably is my guess, is that's what they did. Where did they make the mistake? They made the mistake with believing that they needed you to make a permanent life choice because they probably weren't very educated in addiction work. Probably could have just stepped back and said, 6 months? Hell yeah, I'll take that. Let's get to work. That's action stage. She thinks you're still in pre-contemplation.
How long, you said you haven't been drinking since then. How long have you not been drinking? About?
6 weeks now.
And despite coming to Vegas, that's
awesome.
extremely
That's
impressive. Yeah,
yeah,
you've beaten everybody in this room.
So. Oh, yeah. Since you brought that up, the worst part of sobriety, flying.
Yeah, flying with anxiety and not being able to have that.
Outside of that, how are you feeling about it?
It's fine.
Yeah, I think Jacob just got life coached.
To steal a...
Easy whip. You have just been life coached. Well played, sir. Well played. Touché.
Yeah, it feels fine, but I still have half a bottle of 47-year-old scotch that was really not easy to come by. That it's not like I'm never going to have a glass of that again.
You're not pouring that out anytime soon.
Correct.
Yeah, exactly. Yeah. And this is where I don't think that we would want you to, right? So I just wanted to give you that hot feedback that when I look at the first scenario, that's my guess. When I look at the second scenario, similar, because I think that they said the same thing. I like that you're willing to hear both therapists telling you, hey, man, I think this is a presenting problem. And I think that we can guarantee that that's how you feel because you've even taken the step to say, hey, man, I'm a month and a half, haven't been drinking. So like that, if I were to link up with a new therapist, we can now call this a non-issue. I can now tell them, hey, listen, I used to really have a problem with this. My first two therapists gave me some hard feedback about that. I've removed it from my life. I'm here to do the next level of work.
Well, so I'm shell-shocked now, so even if I do get a new therapist, I'm going to wonder if I should even bring it up.
Let me ask you this.
Sure.
In the first two, did you bring up the alcohol, or was that a question that they brought up?
We usually ask.
Yeah.
It
just sounded when he was talking about it earlier. It sounded almost like he had.
It comes up.
Yeah, it comes up. I can't remember.
Remember that the three people you don't lie to. You don't lie to your lawyer. You don't lie to your tailor. You don't lie to your therapist. So I don't want you to feel like it's not relevant. They're going to be distracted by this. I'm not going to tell them. Tell them, hey, listen, if you told Nick or I, hey, I haven't drank for 6 weeks. I felt like it was affecting my depression, and I'm here to deal with my depression, and I'm also open to feedback. If I struggle with not drinking in the future, I would love tips and tricks on how to... Oh, perfect. And yeah, we're on the same page.
The reason why that would be important for me to know is probably different than I think the reason you think. And the reason why I would want to know that is because if somebody came into my office saying, I haven't drank in 6 weeks, or I haven't done blank or whatever, even if it's not drug or alcohol related, I haven't done whatever for 6 weeks.
I haven't killed a prostitute in 6 weeks.
Right.
It's a winning streak.
This in solution-focused brief therapy is what we refer to as pre-season change.
Yep.
Pre-season change it's this weird thing that tends to happen where people start improving right before they go into therapy.
Yeah.
And that is really important. That's important for me as a therapist to know, because what that tells me is they're on the upswing with no intervention having occurred.
Yeah, it teaches us a
So
lot.
if we can figure out what is causing that, then we can actually build off of that. So
we want to copy and paste.
Solution-focused brief therapy, a lot of it has to do with identifying things that are already producing results.
Yeah.
And becoming aware of them and learning how to manipulate them so that we can do them more often.
And again, to all the listeners and to Easy, he's sitting here in studio, and you're hearing me give him that challenge and saying, don't hold things back from your therapist as a general rule. When you feel like you can trust them, it's okay to reveal that. You don't have to on the very first visit, but I like data because data helps us save lives. Because your therapist, if I was your therapist, I'd hear that and go, okay, so my man's doing okay now for the last 6 weeks, but he had a fall off in December, holidays plus depression plus seasonal depression of Seattle, I think we all assume is part of it, plus alcohol, put him in the ER. Okay, Jim needs to know that because now if I start working with my man and we get, toward the fourth quarter of the season, I've got a bookmark in my brain going, all right, Jim, dial into your dude. No matter how good he seems right now, let's keep it close, be available, take text messages, let's be talking, let's get him ahead. That way my guy's not, potentially vulnerable. So it's all data, Easy. It's all data. So I would encourage you that you're not necessarily thinking ahead about how to hold it back. You're allowed to tell a therapist, hey, listen, it used to be a problem for 6 weeks. It hasn't been. I'm here to focus on these other things, but I'm totally open to chatting about this as we feel the need arises.
Yeah.
And
also,
most people hear that.
There's no point in going to a therapist if you're not going to do that. I don't think.
Good point.
I mean, if you're not going to trust a therapist, then don't go to that therapist. Go to a different therapist. And I would say keep looking. If you go to one, if you divulge that information when it's the appropriate time to divulge that information, and if they don't respond in a way that you feel is constructive, I would first say that to the therapist. Give them that help, give them that information, and if it feels like it's not working out, you continue the search.
Let's address that. So the two big areas so far, Easy, that I think that we want to be helpful to is A, giving you our behind-the-scenes inside baseball, like here's what I think kind of happened, and here's how you can still redeem the story, and here's how you're doing the right thing, and here's how we want to encourage you. But let's talk about the discouragement, right? Let's talk about the discouragement, because even right now, if we look at him and say, don't give up, dude, get out there and find another one, there's a percentage of him that's like, that's probably a good choice.
Yeah,
and then the rest of him is like, God, no, don't do this again.
It's just like any other field, too, where you're going to run into some good therapists, and you're going to run into some bad ones. I mean, in this room right now, there's 2 therapists, and 50% of them are good.
Yeah, yeah. And 100% of the life coaches are better than us.
Yeah, they are.
But so, it pains me to see your discouragement.
I know. Yeah.
That's the thing that does concern me, and I hope that we're able to kind of work through that.
Here's some ideas I had of how people in your profession can reduce that discouragement.
Sure, let's hear that.
A standardized way of collecting family and patient history, so that the patient doesn't have to fill out the same paperwork over and over and over. And I know
you're talking about a database.
Or maybe just give you a copy of everything
some kind
we
of
collected
shared
the first time.
best practice.
Great.
Something.
You could just hand it in.
I know you guys aren't going to solve the world problems here.
We're working on it.
I know. We're working up to it. We need a couple more Patreons to boost their level.
That's right. Then we'll get there. But no, that's good feedback. And you know what's funny is, even as I hear him talking about some of the barriers he's found to entry, I got to tell you, in some ways, Easy, it's very validating for me as a therapist to hear you describe the perils you've bumped into. I have specifically designed my private practice trying to eliminate each one of those. Right. Like the first thing you're talking about, which you talked about earlier with the psychiatrist, not being able to get an appointment. You don't have to call me to get an appointment. I have an online calendar, and it shows you all the appointments, and you can do one on your own and get confirmation that that's your spot. Right. I'm like same day in some cases, people can get it. But that second point about intake, that is one of the most freaking discouraging things, and it pisses me off because like these things are 12 pages sometimes. They want to know what color your grandpa's eyes were, and I'm like, how is any of this? Interview the client. Right. Just do the interview. So that's what I do. I have a 2-page intake. I have a 1-page that just asks you, what's the problem? What are we here to fix? What are your strengths? How can I work with you? And then I have another page that tells you all the legal crap. That's it. Everything else I learned during my intake session. I know what I'm going to ask. I have my paperwork in my brain, but I don't make them fill that out because people, why would I do that? I'm going to ask you a bunch of questions anyway. I'm going to get to know you. Now I have a way to get to, anyway. I'm just ranting, but I agree
my other
with you.
idea, kind of coalesces around the same theme, which boils down to being respectful of the patient's time.
Sure.
And that's if I find a therapist I don't like, I have to go on a treasure hunt to try and find a new one, and it's going to take weeks and weeks and weeks. One idea I had was like a kind of a speed dating scenario.
Oh, that sounds fantastic.
Like get 50 therapists in a room, just open it up to the public.
Yeah.
Just
go find your
cycle
therapist.
people through, because within 5 minutes you can tell if you have chemistry with somebody.
I have never thought of a room in my life that I would less
I
like
was
to be
just
in.
picturing the room too, because I was actually what I was picturing is I picture like in some big conference room we're going to do this speed dating, and people are walking in and like, oh, you're here, you're a therapist. You go, I recognize the sweater.
Yeah.
You go over,
there.
Room
Look at those elbow patches.
Yeah.
Look at those elbow patches. So going to this point,
Nice tweed.
you're and easy. I just want to
so
validate
true.
you. I hope that my reactions are not just self-aggrandizing, which they absolutely should be, but they're also hopefully validating your observations. The things that annoy you are the things that I think are so like systemically annoying about our field that they need to be addressed. Like one of the things on my private practice website is an entire introduction video where you get to know me as a human. So that way when you finish that, you go, oh, okay, so that's the guy. That's, if I'm going to sit down with that guy, that's what I'm getting. I feel like I know, and if I annoy you in that video, you're like, hey, that's not my guy. You know, that's very easy. Just step away. But whenever you just see a picture and like a paragraph, it's hard to look at that and go, is this the kind of human that I'm going to get along with?
Right.
Like, do I think I'm going to gel with them? And the chemistry is pretty important to what we do.
A video is so easy too.
Yeah, it's not hard to do.
If Jim can do it,
yeah, Jesus.
it's easy.
How am I beating you, Washington?
Yeah.
I shouldn't be better at this than you. But you were saying things that you'd like to see the field change. Honor the patient's time. And one way you guys, the field could do that is somehow creating a warm space for us to encounter who the therapists are and get a little sample so that way we know what we're walking into and find the right fit.
Right. Do some outreach. Don't wait for the people to come to you.
Yeah.
And like Nick was saying earlier, don't get promoted to the point where you're not helping people anymore.
Sure. Yeah. No, that's true. That's true. And that's a big part.
I said that as
an observation.
I am the guy that happened to.
Right, and I get it. I mean, it happens everywhere.
Right.
You put in, you feel like you put in your time, you do the grunt work, and then you expect a reward.
Right.
And
well, they want to progress in their career, and usually that means leadership. But no, there's points. I think at the end of the day, the heart of your criticism on that last point was, I just want to make sure that patients are having access to care. And that's it. That's not a crazy request. And it's troubling because when I think of Washington and when I think of Seattle, my brain wants to remind me that I think they're pretty well off in the rankings. I think of them as a better state than Nevada. But clearly
we're 51st, so yeah.
It's pretty everybody's better than us. We look up to Mississippi for crying out loud. But he's in a urban area that can be heavily populated, that can make it a lot harder too. So I want to make sure we're catching each of those points. That so far you've told us about the intake paperwork process, the warm kind of experiencing of a therapist and making sure they're available to see somebody, and you were talking about availability. Or were there other things that you were thinking of?
No, those are
Those are the big ones.
Big ideas.
So at this stage, you had told us earlier, guys, I'm not super encouraged. I'm not super revved up to try this process again. I want to make a pitch to you and see if I can talk you into trying this again. Okay? You don't have to say yes, but I just want to take my shot.
Go ahead with your pitch.
He's going to humor you.
Okay, I've prepared a PowerPoint. Go ahead, Jacob. Jacob's going to put up a PowerPoint, and I just have a few moments here. I just want to talk about it. No, but here's one argument that I think is encouraging, and I think that you would agree, you'd want the general listeners to hear me say this too, is whatever experience you're about to have, if you were to step toward a new therapist, that experience will be fundamentally different. Here's why. Not just because it's a new therapist. It's a new patient. you've actually, even though you don't know that you feel like you've made a ton of progress in these encounters, in truth, in many observable ways that Nick and I would actually measure your success, we would say you have. Your self-awareness has deeply increased. Your willingness to sit down and talk with somebody, even addressing some of the social anxiety that comes with sitting down with a therapist and kind of having a feel for what you're going to talk about and what they're going to ask you, you've upgraded in all those levels. You've stopped drinking for 6 weeks, which itself is an achievement, but so is the thing that happened 6 weeks ago, which is you getting to a place in your life where you're saying, this isn't helping, so for now I'm going to stop. That wasn't something you walked in on the first day of therapy with before. You were there to learn. You were there to discover. So my argument is that the patient has changed a lot. And you only have control over you. You don't have control over who the other human at the table will be or in the room. And I believe that you're going to walk in a different person and encounter a different person, and there's always new opportunities to get something. I don't believe any one therapist has all the pieces of the puzzle, but I know that every single human we encounter, including therapists, has a few pieces of our puzzle in their pocket for us. And I think if you approach it from that angle of, I'm here to figure out what this person can give me, what this person can support me on, that can continue my journey, even if that's just, I want to decrease my depression by 5%. Wow, what a small goal. But if that therapist is able to kind of arc the line a little bit more in that direction, even if that therapist is not there to be a miracle worker, there's patients I have that I am not tomorrow going to wave a magic wand and resolve the problems they're facing, but I am the one human that they have a regular pattern with who's aware of the problems, who they can be honest as they grapple through them with, and we're working through it together, and there's that partnership, that camaraderie, and that accountability where I'm one more voice in their life. And even if we could find that for you, even if it was every other week or once a month, just something into your world that we're making sure that you feel like you're talking to somebody, even if that's just to prevent things from getting worse. Because, I'll use your own words against you, Easy, as I wrap up my pitch. You said, listeners, I don't want to step on the emergency care system, but try everything before you get back to that.
Yeah.
Well, I would include that argues having a maintenance relationship with a therapist to avoid ever having to go back. It's just a pitch. You don't have to respond to it. We all assumed that I wooed you.
Right.
Yeah, did we?
According to Mental Health America, the rankings based on adult and youth measures, as well as prevalence and access to care measures, Washington is ranked 45th.
Way to go, Washington.
So not great.
Not great. But
yeah.
it's
Nevada's still 51.
Yeah.
Out of 50. That's impressive.
Yeah.
So yeah, you're definitely in a tough area, plus being in a metro. There's a lot of trickiness to this. And you know what? One more thing that I'll add that I want to appreciate the complexity. I hope nothing easy that I've said today sounded dismissive to you. I hope, if anything, you feel like, Jim heard what I said, and he actually tried to broaden my awareness for some of the inside baseball. Another piece of inside baseball that can be discouraging is sometimes it's not even the therapist that has control. Sometimes it's the insurance. And sometimes the insurance will say, I'm giving you 8 sessions until you DX this, and if you can't, DX is diagnosed, until you can diagnose this problem or show me an argument that this person's willing to do this step. Sometimes the therapist's hands are tied, and when they're asking you to achieve a milestone, it isn't just because they think it's best for you, it's because they also know that's the only thing the insurance will allow to open up the care.
That had occurred to me, and one of the things I might do different in the future is maybe try to cut the insurance company out of the equation, reduce the potentially what do I want to say? The interfering variables, right?
Yep.
Right.
Yeah. And I wish that we didn't live in an America where that was the case. And you've heard Nick and I rant about this. Insurance companies could be a force for good. I don't think they presently contribute a lot to the solution. And especially in mental health, it has just been... It's insufficient. It's insufficient. And so I realize there's a huge cost to it. I realize that everybody would rather pay a copay than the full fee. A lot of therapists, if they, I'm unusual in the world being only a full fee and outside of insurance. A lot of therapists will see you and say, do you want to leave the insurance at the door? And they'll give you a cash rate that's like a lower rate than what they really would have collected from insurance, because they don't mind the fact that they're getting, their income comes right then instead of having to wait 6 weeks from an insurance. Yeah. So sometimes there's some negotiation, which I realize everybody feels uncomfortable with. Nobody wants to discuss this stuff with a healthcare provider. You just want to get to the part where you're getting help. But if you can wade through the discomfort part and get to that business end finished, final, and done, There's a lot of freedom that comes with that. Their mentality definitely shifts where they go, oh, there is no longer anybody else in our relationship. It is me and you. And that, I think, I've found very liberating. When I cut insurances out of my practice, changed my life, and it changed the relationship I have with my patients, too.
Yeah, that makes a lot of sense.
Yeah. So, thank you for being here.
Yeah, man.
We appreciate having you.
Thanks for having me.
And, you know, lean
this has
in,
been
brother.
great.
Lean in. I mean, the fact that you removed this thing from your life for 6 weeks, to me, demonstrates that you're a man who's in the middle of trying to figure out what's going to work for you. And that tells me that you haven't given up on this. It tells me that you've actually equipped yourself and you're taking the next steps. And I think that it's consistent with what you've already been doing to continue to do self-work, whether that's visiting with a therapist, whether that's using one of the online groups, whether that's just joining a group. It could also be, there's a lot of also in-between areas like the National Alliance on Mental Illness. They have depression groups that are kind of like Alcoholics Anonymous, but for people with depression. And they give each other skills and tools, and they share ideas. There's mental health agencies that won't ask you to sit with a therapist but might invite you to be a part of a group, which sometimes I realize can trigger social anxiety, but sometimes it's a little bit nice to be a fly on the wall and listen to other people kind of go through their stuff and not feel like you're always on the hot seat. So a lot of different options, man. And I'll call to the listeners, everybody that's out there, if any of you are in the Washington area, specifically in Seattle or the surrounding burbs, if you have some suggestions that you want to pass Easy's way, he is on our Patreon. But even if you are not a patron and you don't necessarily want to kick us a buck, that's fine. Email us, podtherapyguys@gmail.com, podtherapyguys@gmail.com. Email anything you've got, even if it's suggestions or tricks or, you know, hey, this group is really good or I know this therapist or whatever. We will receive anything you've got and we will make sure we're passing it his way so that he's walking back home from Vegas with a few more tools than he walked in with.
All right, well, we're going to take a quick break, and when we come back, we will discuss helping a sister through pregnancy. You're listening to Pod Therapy.
Go for it? Okay. Welcome. This week's other TheraProducer sponsor is Robert Brownie Jr. Mint. This week's trivia question is in honor of Robert Brownie Jr. Mint. Because it takes Earth approximately 365 days, 5 hours, 48 minutes, and 45 seconds to travel once around the sun, if we didn't have a leap day after 100 years, our calendar would be off by approximately how many days? Wow. See, I already know the answer because I did the math in my head.
Yeah, no, you don't.
If you'd like to join Robert Brownie Jr. Mint and make the show possible, you can go to patreon.com/therapy and sign up. Again, that's patreon.com/therapy.
We're back. You're listening to Pod Therapy. Our next question is about helping a sister through pregnancy.
All right. Dear Pod Therapy guys, my husband is a big fan and has recently introduced me to your podcast. I will try to keep this concise. My name is, let's say, Judy, and my sister's name is Deborah. We both grew up in an extremely right-wing conservative Christian home. I am the oldest by 8 years and have become the black sheep of the family by marrying and becoming an atheist, so I am used to their wrath. However, my now 18-year-old sister has always been the good one who is a straight-A student attending a good college program with the promise of working internationally one day in a great career. Well, on Monday, she called me and said she is pregnant. I told her everything will be okay, you've got several options, don't worry. She said very calmly that she had already set an appointment with Planned Parenthood and had begun the legal steps of getting an abortion in our state. We came up with a plan where I would pay for the procedure, go with her, and have her stay the weekend at my house so nobody else would ever know. The very next day, my aunt confronted my sister, Deborah, and told her that she needed to tell our parents that she is pregnant. Apparently, Deborah was having a panic attack after talking to the father-to-be and told her cousin/best friend for emotional support, and it got passed to our mom's sister, my aunt. Without consulting me, she told our parents, who are now trying to take control of the situation. I wanted this to be her decision, and now I am worried that she will cave to their pro-life guilt tripping. I know that my role needs to remain unbiased support. I am dedicated to not parent and let her take responsibility for her own actions. If she still decides to get the abortion, it will now be up to her to deal with the whole family knowing. I can be supportive, but I can't totally fight the battle for her. I am used to the family thinking I'm a center, so I'm not worried for myself in that scenario. In the event that she decides to become a mother and have a baby, I worry that she will have only done so to appease our parents and will hold resentment towards her child and suffer from severe postpartum depression, not to mention that this will be the end of what would have been a stunning career. I am assuming in that situation all I can do is direct her to a good therapist and continue to love her, but not parent her. In the event that she decides on adoption, I am very worried that it will be expected by Deborah and some of the family that my childless but established house-owning husband and I adopt the child. We absolutely aren't going to do that. It would be a horrible, unhealthy situation because my husband and I would become parents for the wrong reasons. So here is my question. What is your advice on maintaining boundaries but still being supportive? And how do I deal potentially with my family's perception of I am choosing my husband over my sister because we absolutely will not adopt her potential child? Thank you very, very much for your help, Judy.
Glad we're closing with an easy one.
Yeah, I was just going to say.
Oh, we can wrap this up. This is easy.
What's this, a couple of minutes?
Simple.
Oh, hey, Jim's got this one.
30 seconds, I think
right.
we could probably close in on this one. Yikes! That is intense.
Where do you want to start? This is intense. So,
All right, let's start with the most important thing. I need to talk to you about my Lord and Savior, Jesus Christ. Okay? I think that could solve all of this.
Look at
You got a new gardener?
Jesus is amazing. All right, but the first thing I want to appreciate to the writer is I want to appreciate that you're facing a situation that has so many dynamics, right? And I actually really...
Boy, did it balloon quick.
Yeah, jeez. And I really admire your self-control. The one thing the writer's saying, Nick, that right off the bat I think both of us appreciate is I realize I don't have control over this. I realize I'm not going to parent my sister. I realize that even though I have a strong opinion about how this should go, and it would be a darn shame to see my sister, give up her career and things like that, I realize it's not my place.
Not my monkey, not my circus.
And different from her parents, right? Because Judy's saying, well, my parents are clearly imposing their will. I'm trying to not do that. I'm here to support and be available as an exit, but I'm not necessarily going to impose myself. Very wise, Judy. That A, would only complicate things. It would only hurt your little sister. And I think B, it only hurts you because then you come into this thing with a dog in the fight. You don't seem authentically just there to be a helper. And so, and I think it's also good for your own mental health. Like, you don't want to be carrying around a flag saying, I'm on team abortion. Be on team Deborah. Like, just be on your sister's team, available for whatever that is.
I want a flag that says that.
Team abortion.
I want a flag that says I'm on team abortion.
I promise you that's on Amazon right now. I promise you it is. The second thing I would observe back to Judy is, and I want to appreciate this, Judy, because at the end of the day, I totally see where we're conflating multiple things. We're conflating conservative Christianity and a pro-life stance with freedom, individualism, and abortion, and I'm fine with that. But I also want to add a layer to this. I've had lots of patients who have gone through an abortion, and to a person, it is a deeply psychological experience for them, regardless of other things, and regardless of complicating factors like religion or politics. It is a deeply psychological choice.
Best case, it's not nothing.
It's not nothing. And so, Deborah, I'm sure you know that. Or I'm sorry, Judy, I'm sure you know that that won't be the case for Deborah. But I guess that's why I think you're extra doing the right thing, because at the end of the day, it's so important that Deborah sort of make her own choice, because it has to be something that she feels like she wasn't imposed on, like she could do it herself. And I don't know that she's going to be guaranteed to get that, because the parents are going to parent. This kid is 18 years old. If my kid's 18, that doesn't mean that I suddenly feel like I don't have a voice in their life. I am going to step in and make my thoughts known to the kid. And I think that's what parents are going to do. And I don't think they woke up evil that day. I think that's what they're going to do. So it's an imperfect situation. Yeah, it's kind of what they're supposed to do.
Yeah.
So it's an imperfect situation.
If I were in this situation, I would just be constantly reminding myself that this isn't about me as much as other people try to make it about me.
Right.
The best thing I can do, as she pointed out, is just be there, be a support system, be there and ready. I mean, as far as Judy saying that, me and my husband are not going to take on this responsibility of the baby.
Yeah.
Absolutely. And you have that right. And I agree with her. I think that would be taking on this responsibility for the wrong reasons. And then now it's not just an issue of, it's oversimplified. And if anybody in the family says this, as she had put in here, that I'm choosing my husband over my sister. No. If anybody actually in the family says that, they are severely overstating that it's so much more complicated.
Well, it's just obviously
or oversimplifying it.
Yeah, it's obviously false.
Definitely, because it's not just that. It's your livelihood, your lifestyle. This isn't the way that you plan for this to go. It's gonna significantly change the dynamics in your marriage with your husband. I would hope no one would expect.
Well, but this is a good moment to just reflect for a moment on one of the things that I think women go through that is unique. If Judy was Justin and it was just the brother and like my little sister's going through this, I'm writing because I don't really know what to do. I don't think Justin would be worried that the whole family's going to come to him and be like, hey, we expect you to adopt your little sister's baby. Just the gender dynamic difference and the stereotypes and expectations fall away.
I don't think a brother would even. I don't think that would even cross their mind.
Nobody would even think to ask Justin.
And here's the other
thing. But
with
Judy,
though,
it's like, well, if you're going to be a supportive sister, you need to mother somebody else's child. Like that's unfair.
Now she does say, I'm very worried that this is going to be expected. So here's the other point too that I want to make is that oftentimes when we're in a stressful situation, we can sometimes draw conclusions or think that other people are expecting things of us when they're really not.
Right.
Sure. It could be very possible that thought has not crossed anybody's mind. So we don't necessarily want to jump to that conclusion.
True. Yeah, this could be something that we came up with that isn't necessarily the case. But regardless, Judy, at the end of the day, you've got to be prepared, as you use that word boundary, to clarify for the family, I am not available to do this. I am not available to adopt a child at this time in my life. I am not available to do that whether it's a child from China. I'm not available to do that whether it's your child, Deborah. I do consider myself part of this family. If you, my little sister, have a child, here's what you could probably realistically expect. Yes, I will babysit, from time to time. You need to understand that's not going to be, Judy daycare. Here's what you can expect. Mm-hmm. And you might get some flashback from that, and that might just be other humans in crisis who feel like you're not in crisis with them. And that's something Nick and I are very used to. Nick has a famous saying about emergencies and planning or something like that.
Oh, lack of planning on your part doesn't constitute an emergency on mine?
Exactly. Yeah. And so like in this case, I would say that that's going to be a similar experience, is that other people have a hair on fire. We have to make decisions. Oh my gosh. And they might turn to you in a sense of urgency and be like, are you with us? Are you against us? What are you going to do? And you have to sort of take that step back mentally and give yourself permission to be unliked for right now. Mm-hmm. Give yourself permission that humans in a crisis are not making decisions based on how they really feel or on the full totality of your experience as a family member. They're in a state of fear. So that doesn't mean that they're accurate, but you have to be careful not to be drawn into that and start believing those things for yourself.
Right. So she's asking for tips of how to set and enforce these boundaries. Yeah. So number one, I think the one thing that I like about the way that Jim always words this is, what are you available for?
Right.
Because then that really basically talks about, it kind of shifts your way of thinking this onto, here's what I can do, as opposed to, here's what's expected of me, and here's what I cannot do. It's, here's what I'm able to do, and here's what I'm willing to do. This is what's going to work for me. And then you build everything around that, right? Yeah. And so I think taking that approach and maybe even sitting down and writing down, like, if she chooses this, here's my ways of being supportive. These are the things I can do.
Right.
Here's how I'm available. If she wants to make this decision, here's how I'm going to be available in this scenario.
Yes, that's a good idea.
And then be able to actually, kind of visualize what this actually looks like. The other really important piece, I think step 2 to this is going to be very good self-care. Because oftentimes the very first thing that somebody's going to do when you draw a line in the sand, the first thing they're going to do is cross it. Right? Because as soon as that line's there, they want to push that boundary.
Right.
And so you're going to have to stick with it. If you said this is what I'm available for, then it's going to be very important that you stick with that. And then, like Jim said, that means that you may be disliked for a little bit, and that's where that extra self-care comes into play, being active and, doing some fun things with your husband to kind of keep the focus back on maintaining that relationship, maintaining your individuality, being able to work on you to be able to step out of that.
Yeah, a couple of quick last observations on this concept of making a list. If you were to make a list of things you're available for and not available for, or how you choose to respond in different situations, keep that a little bit to yourself. Don't blast that in an email because it will come back to bite you. Never add things that are punitive to that list. Like, Deborah, if you choose to have this baby, I'm not available to so much as buy you a sweater for that kid because you made your own damn choice and you didn't listen to your big sister. That's punitive, right? And so I don't trust your judgment at this time to decide what your relationship with your nephew or niece is going to be like for the rest of their entire life. I don't think that you should be put in that position right now. It's just being clear that I am not part of the emergency response team that's going to inherit or adopt the child. I am part of our family, and I will be an aunt to your child. I will not be a mother to your child.
Yes.
That's the difference. That's the boundary.
There's a big difference between a boundary and an ultimatum.
Yes.
An ultimatum is, I'm going to do this so I can change your behavior.
Right.
Whereas a boundary is, I'm going to set this boundary so I'm protected, so that I'm okay.
We like boundaries. And so the boundary, Judy, that I'd want you to be drawing is, I'm available to be an aunt to this child. I'm available to be a sister to Deborah. I'm available to be a daughter to Mom. I am not available to be a mother to this child. And that's a fair boundary. And that doesn't come in with all these specific things of like, I will take them to daycare, or I will chip in on this, or I will buy them a Christmas present. No, you don't have to get that specific. But just teaching the boundary of identity. I'm not available to be a mother to this child. I am available to be an aunt. And we will all discover what that looks like. I don't know who I am as an aunt. So I'm not making any promises. I'm not going to take anybody in, but I am available to be part of this family, and I support Deborah in whatever decisions she makes for whatever her reasons are. And Judy, last thought that I'll give you is, one thing I'll challenge you on, even if Deborah makes a decision which is 51% motivated by what her parents think, that is actually still Deborah's decision for Deborah's reasons. And you need to honor that, even if you disagree with the way she added it up. If an 18-year-old is being counseled by their parents, that influence comes organically, and that's part of it. And so you're going to be a lot better off the faster you make peace with any decision that Deborah makes, even if that's based on your family.
Mm-hmm.
A lot there. But hey, really difficult situation. And, best of luck to you. Please keep us in the loop. This is going to be an ongoing thing. Whatever comes next, it's going to be ongoing.
All right, we're going to take our next break, and then we'll be back and wrap up the show. You're listening to Pod Therapy.
This week's other TheraProducer sponsor is Kayla Lansbury. In many parts of Europe, an old tradition holds that Leap Day is the only day that is socially acceptable for a woman to do what? Ooh, this one's sexy. Could be.
No.
If you'd like to join Kayla Lansbury and make the show possible, you can go to www.patreon.com/therapy. Again, that's patreon.com/therapy. Pod Therapy After Dark, ladies and gentlemen.
The answer, of course, is wash her underwear. Wash her underwear is the answer.
Yeah, which is a
4
euphemism.
years, filthy underwear.
It's disgusting down there, but we got to watch these
But
things.
once every 4 years, it's minty
tie-dye.
fresh.
Minty fresh. Thank God it's a leap year. I've been just hurting.
No real announcements other than same announcement we had last time. David Villalon's NAMI fundraiser.
NAMI fundraiser.
Yep. Go to NAMIWalks.org, click on the donate button, and then search in the search bar, put in David Villalon, and his stuff will pop up. So he's still working on his goal.
Yep.
So
Chip in, help him get it done. And we want to thank our patrons. We do have a new THERAPOD, David Sorensen, who got acknowledged now thrice for his
3
support.
times.
Thrice. That's what thrice means.
Yeah, I know. Who I did once, you did once. Who's the third?
This is now the third.
Oh.
Yeah.
Okay.
Jacob, acknowledge David Sorensen.
I will not.
You get 2, Dave. That's 100% more than anybody else got. Welcome to the THERAPOD community. And we want to thank our THERAPRODUCERs. We want to thank our Elite 8, the mysterious and shrouded Illuminati members of the fan club. Smitty Scoop, Jake Schneider, Robert Brownie Jr. Mint, Kayla Lansbury, David Data Scoop, Villalon, Judy Schneider, Nathan's Hot Dog Scoop, Dr. Ben Don, and ex-officio board members Ellie O'Dare, Dan Martin, and ex-officio board member and chairman of the board, and guest with us today, Easy Scoop.
Easy Whip.
Easy Whip.
Jesus, you had one job.
I did pretty damn good.
Number 11 out of 8.
That should be a thing.
Yeah.
I'm the 11th out of 8. What? It's a pod therapy thing. You wouldn't understand.
And if you'd like to hear this episode uncut and unedited and enjoy our spontaneous side projects,
and why
go
wouldn't
to,
you?
to patreon.com/therapy. And thank you for supporting mental health.
That's all the time we got for this week's session. We want to thank our landlords, the Ice Cream Social Podcast, and Easy Whip, who joined us in studio today and shared about his journey. We really appreciate it. We want to, remember, Pod Therapy isn't something you should keep all to yourself. Help us reach others by opening this episode's description in your podcast app and copying and pasting the link we've provided to somebody who needs it. Don't forget, you can go to facebook.com/podtherapy, on Twitter @PodTherapyGuys, and at patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tanchman.
I'm Jim Jobin, to the left of Easy Whip.
Thanks, and we'll see you for your appointment next week.